Welcome to the first Ifso Integrated Health Webinar for 2022. I'm Andrea Schroeder. I'm the Director of Tailored Clinics, a bariatric surgical practice in New Zealand. I've been a bariatric nurse for 22 years and I'm also on the Ifso committee. I'm privileged to be able to offer this webinar tonight on support through the menopause transition after bariatric surgery. I'll do some introductions first and then we'll do some housekeeping before we start. Our presenter is Nicole Freebarn, a registered nutritionist who works here at Tailored Clinics in New Zealand as part of our multidisciplinary bariatric team. Nicole works with patients through their pre and post-surgical journeys and oversees the management of the clinical nutrition team. Previous to working in this role, her background was in women's health and hormones. She's passionate about helping women to better understand their bodies and take a holistic approach to their health and well-being. She studied a Bachelor of Science, double majoring in human nutrition and genetics. She's learned a great appreciation of the importance of taking an individualised approach to health. Along with our presenter, Nicole, our panellists this evening are Dr. Yitka Graham, who's the head of the Helen McArdle Nursing and Care Research Institute and Associate Professor of Health Services Research at the University of Sunderland. She's on the Ifso Integrated Health Committee, the Scientific Committee, and the co-chair of Ifso Europe. Her work has been widely published and presented internationally. We also have Kate Berridge, a bariatric nurse specialist, also from New Zealand, who's passionate about ensuring that long-term support is available for those who've undergone bariatric surgery. She's the founder of Beyond Obesity, a nurse-led independent practice who's improving the lives of bariatric people. So just some housekeeping. This webinar will be recorded and will be available tomorrow to all Ifso members through the member section of the Ifso website. For any non-Ifso members, it will be available on the Ifso YouTube channel, so please encourage your colleagues and friends to watch it there. The format for this session is that we'll start with the video presentation, we'll have a couple of polls first, and then we'll finish with a question and answer session. So remind your friends to get on and have a look, and we'll also remind you to type in your questions so that we can answer them at the end. We'll start the presentation now.
Hi everyone, my name is Nicole Freebarn. I'm a registered nutritionist working for Tailored Clinics in Hamilton, New Zealand. And in my private practice, I work more so as a women's health nutritionist. So I'm honoured to talk to you today about how we can support our patients through the menopause transition after bariatric surgery. So an overview of the things I'll discuss. We'll start with the hormonal changes that happen during both perimenopause and menopause, the impact that these changes can have on bariatric surgery outcomes, in particular on body weight, and most importantly, how we can support our patients through this phase of life. So the hormonal changes that happen. First of all, just to get clear on the difference between perimenopause and menopause. Perimenopause is that lead up to menopause. So for some women, it might be a couple of years. For others, it may be more than a decade. And this is typically the time where most women will experience symptoms. Menopause, on the other hand, is clinically defined by that 1 year after periods have stopped happening. And for most women, this is when periods will, symptoms will start to settle down, periods and symptoms. So the hormonal changes that happen throughout a woman's life is illustrated here. In blue, you can see the progesterone, and the red dotted line is estradiol. So you can see there in puberty, hormone levels begin to rise and they cycle fairly consistently through the reproductive years until we get to perimenopause, where we get some fairly dramatic changes going on there. So progesterone is declining as ovulation stops happening, and estrogen goes on a bit of a roller coaster. And you can see there at some points, estrogen levels may be higher than it's ever been before in a woman's life. So big load of estrogen during perimenopause, which is a big contrast to what we see in menopause with low estrogen levels, low progesterone as well. So that estrogen roller coaster that we see during perimenopause causes an overall higher load of estrogen, right? And can bring about quite a lot of symptoms for women. So those symptoms associated with more high estrogen can be things like breast tenderness, heavy periods because estrogen is driving the growth of the menstrual lining, bloating, irritability, and then symptoms of low estrogen may be things like hot flushes, night sweats, more so those temperature related symptoms, low mood, and heart palpitations. Progesterone is on that steady decline, and low progesterone can cause things like increased stress and anxiety. Progesterone is like our natural anti-anxiety, nice calming hormone. It can cause poor sleep, particularly in the second half of the cycle, PMS, fluid retention, sugar cravings, again in that luteal phase, because that's when progesterone would typically peak. And also more frequent periods, because progesterone helps to hold that menstrual lining in place. So with less progesterone, that uterine lining will fall away more frequently. So the impact that these hormonal changes can have after bariatric surgery, and in particular on body weight, unfortunately can cause a weight gain. And this tends to happen more so, or can happen gradually, but more so in menopause, can bring about the seemingly random weight gain. And what I mean by that is a woman may change nothing in her routine and in the foods that she's eating or the exercise that she's doing, and then suddenly can gain this weight. And name a more frustrating thing to happen after bariatric surgery, right? So there's a few things that can be contributing to this. One of the major ones is a dramatic change in estrogen throughout, from perimenopause and also the reproductive years to suddenly low levels in menopause. The body doesn't like that dramatic shift. And as the ovaries stop producing estrogen, the other place that the body can produce that quite effectively is our fat tissue. So the body ramps up fat cell production in order to kind of mitigate that change. And this can be made more dramatic if a woman was pumping out quite a lot of estrogen through her reproductive years, which is often the case with our bariatric patients, right? Because they've had more body weight during that time with more adipose tissue producing that estrogen. So that difference is higher. Other changes that we can see that contribute to that weight gain is blood sugar changes, because estradiol has an insulin sensitizing effect, and also metabolic changes because progesterone has a metabolic, it helps to increase metabolism. So there's those biochemical changes that are going on, as well as high cortisol. So there are biochemical changes, which I will touch on shortly, that can cause higher cortisol, which also causes weight gain. So don't underestimate the impact of stress. So when the body has higher levels of cortisol, which can happen for various reasons nowadays, that sends a biochemical message to the body that we need to store fat, because traditionally when we had high levels of cortisol, it would be in times of food scarcity, right? It might be if we were in a famine or a war and food wasn't readily available. So when cortisol is high, the body goes, okay, some sort of danger, let's just ramp up the food reserves. Experiencing that after bariatric surgery, experiencing that weight gain is a stress in itself. So we can get this kind of cruel cycle going on when cortisol is high. I really like to reiterate to my patients that it is a normal hormonal response to feel more susceptible to stress as progesterone declines. One, to kind of stop that cycle, but also take that pressure off themselves so that they're not feeling that it's anything they've done to make themselves cope less well. There is that hormonal change that is causing that increased susceptibility there, and that tends to really help. More specifically on clinical treatment strategies, and this is focused more so on perimenopause. So we want to start that treatment as early as possible. We'll start supporting our patients. And one thing that we want to support there is estrogen detoxification. So during perimenopause, when that overall estrogen load is higher, we want to be making sure that the body is detoxing that really effectively. We don't want that high estrogen to be hanging around. So estrogen detoxification happens in 3 phases. Phase 1, where it's neutralized to an inactive form. Phase 2, conjugated into a water-soluble form so that it can be then eliminated in phase 3 through the gut. So liver and gut health are therefore really important. So starting with supporting the liver, there's kind of two sides to this. One, we want to reduce the workload that the liver has. So limiting things like caffeine, alcohol, sugar, and processed foods that require more detoxification work to process. And also things like chemical substances, environmental toxins we may be exposed to. We can be exposed to things in our cleaning products or body hygiene products, BPA plastics, things like that, can contain xenoestrogens, which are endocrine disruptors. They're similar to estrogen in chemical structure, but they have a more toxic estrogenic effect on the body, so can be very disruptive for hormonal balance. So we want to be limiting those as much as possible. On the right there, we want to be supporting detoxification pathways as much as possible. So we want to be supporting the liver to actually get that work done. So that requires nutrients, things like methylated B vitamins, zinc, magnesium, certain amino acids, so ensuring that protein intake is optimal. And then also cruciferous vegetables such as broccoli, kale, Brussels sprouts. That family of vegetables contains a class of nutrients called glucuronidase. And they help, for example, DIM, you may have heard of, they help more specifically with phase 2 liver detoxification. And then we also want to be supporting the gut. So within our gut, we have millions and millions and trillions of bacteria called our gut microbiome. And within that, there is a collection of bacteria called the estrobilome. And they help to regulate and metabolize estrogen levels in the body. If we've got a bit of a gut microbiome, a gut imbalance going on there, some dysbiosis, then we can have higher levels of an enzyme called beta-glucuronidase. And what this enzyme does is goes and finds that nicely packaged up estrogen, unpacks it, converts it back into that unconjugated state, where it's then reabsorbed into the bloodstream and sent back to the liver for round 2. Obviously, this is the last thing we want to happen. So ensuring that our gut health is optimal is actually really, really important. So ensuring that we haven't got a gut microbiome imbalance going on there, and also making sure that bowel movements are really regular, because you're pooping out that extra estrogen. So we want to make sure that all of that waste product is not staying in that gut for too long, giving that beta-glucuronidase an opportunity to reabsorb it. So making sure that patients are getting enough fluids, getting enough fiber, and that they're not constipated, super, super important. And then other things that can be helpful to support gut health may be things like prebiotic foods, a probiotic supplement as well, and then avoiding things like alcohol and processed foods that can encourage the growth of more bad bacteria in the gut. I'll also, just note there as well, if we have a patient where we need to support the liver and the gut, we want to make sure that we're actually starting with the gut, or at least supporting it at the same time, because there's no use, as I was kind of saying, supporting the liver on its own if gut health is a mess and we're just getting that reabsorption happening. So whilst we're supporting that estrogen detoxification, we want to be doing the opposite with progesterone. We want to be supporting progesterone production for as long as we can, because we want to minimize that difference between the two. And a really big focus here is stress. So you can see here on the left the biochemical pathway in which progesterone is produced, derived from cholesterol and then downstream converted into progesterone, and then further converted into cortisol if needed. So you can understand how there may be this bit of competition between progesterone levels and cortisol levels in the body. And if we think about their biochemical roles, so progesterone, I guess, major function there is making a baby, right? It's holding our menstrual lining in place, pro-gestation. So really important for reproduction. And cortisol biochemically is keeping us alive, right? Produced in times of high stress. So if we've got a case, if the body senses any stress, it goes, okay, well, something's not right here. It's possibly not a good time to bring a baby into the world. Let's not worry about progesterone. Let's ramp up that cortisol production. So unfortunately, progesterone is always going to lose out to cortisol if there's stress going on. So big focus is reducing stress as much as possible, or at least changing the way that we respond to it. So again, there's kind of two sides to this. One, I want to be limiting those energy stealers as much as possible. So any kind of stresses on the body. And that may be biochemical, things like poor diet, nutrient deficiencies, alcohol, also things like high intensity interval training. Too intense exercise can actually be a stress on the body that can increase cortisol levels. And then also things like unnecessary tasks on the to-do list and stressful situations for the individual. And, you know, easier said than done to limit these things. I'm also very aware that for a lot of women, menopause hits at a time that they are incredibly busy. So they may have a young family or be at the peak of their careers. It's not exactly a nice stress-free time to go through these changes. So as much as possible, if we can delegate or reduce the tasks on the to-do list, that can be really helpful. But often what we have more control over is these things on the right. So improving the way that our body responds to stress and communicating to our body that whilst, yes, there's a bit of stress going on, there is cortisol there, we're not being chased by a wild animal, we're probably not going to die. So one way, and one of the most effective ways that we can reduce cortisol levels in the body is through diaphragmatic breathing and extending the length of our exhale with our breath. So bringing in a breathing practice can be incredibly valuable. Things like meditation, yoga, that legs up on the wall yoga pose can be very helpful, a good way to bring in that breathing practice. Focusing on quality sleep, again, can be easier said than done with that low progesterone, but bringing in some good sleep hygiene practices can be helpful. Focusing on more gentle restorative exercise, things like walking, again, yoga, Pilates, swimming, that kind of thing, as opposed to high intensity training or running a marathon, things like that. Ensuring that you're having regular meals, so ensuring that patients aren't skipping meals, as that will increase cortisol levels and increase that picture of food scarcity. Supplement if required. Obviously we know it's required after bariatric surgery, but I will touch on that a little bit more specifically shortly as well. And then also things like a gratitude practice or improving self-care practices can be really valuable to improve our perception of stress as well. Strategies more specifically for the weight management side of things. So you'll remember I talked about these biochemical changes on the left here that can contribute to weight gain. And then on the right, some strategies to help with this, which are largely focused around blood sugar balance. So we want to be quitting sugar, reducing carbohydrate intake, particularly at breakfast, can be valuable to kind of mimic that overnight fast. Reduce snacking, or at least make them high in protein. Increase strength training to sensitize our muscle tissue to insulin, reduce stress for that cortisol picture, and also phytoestrogens, so plant-based estrogens that are found in things like flaxseed and soy can be quite helpful as well, as they do have a weak estrogenic effect. Supplements. So the most common one that I would prescribe would be magnesium. It's a wonderful mineral to help support the nervous system, sleep, stress, also helps to metabolize sugar. That's listed there, the dosage and the type I would typically prescribe. Calcium, really important after bariatric surgery anyway, but particularly important for bone health after menopause. Zinc, vitamin D and vitamin B6 all help to support progesterone production in the body. Typically, these would be covered in adequate quantities in most bariatric supplements. It's not often that I would prescribe them as an isolated nutrient, but if indicated in the bloods, yes. Addressing an iron deficiency is also really important, particularly during perimenopause when periods can be heavier, because an iron deficiency will exacerbate heavy periods, as counterintuitive as that is. And then I have also listed some other further support on the right there if indicated, if patients need additional gut support or stress support there. So to summarize everything I've kind of discussed and what we want to focus on more of on the left here, less of on the right. So more fiber, ensuring that gut health is optimal, ensuring that bowels are regular, adequate protein, making sure that supplements are adequate in terms of magnesium, methylated B vitamins, things like that. More restorative exercise and a nice breathing practice, and more self-care practices. And then we want to reduce as much as possible things like sugar and processed foods, alcohol, caffeine, those liver loaders, intense exercise, and again, an individual thing with that, and unnecessary stress as much as possible. Thank you so much for your time.
Thank you so much, Nicole. That was an amazing presentation. And I think we'll all agree that there's lots of tools and strategies there that we can use for our bariatric patients. I think one of the really important things about this topic is that I know in our practice, 87% of our patients are women, and the majority of our patients are of our female patients are between the ages of 35 and 50. So a really good majority of our patients are going to experience menopause at some stage. So, you know, and we know that, you know, the impact that it has on their health and weight and quality of life. So right now we're going to go, we've got some poll questions, and we're going to pop those up, and we'll give the audience some time to answer each of the questions. So the first question we have here is, what do you think the key concerns are for bariatric recipients in regards to menopause? So you can select from the following: breast changes, weight regain, hot flushes or flashes, and bone density changes. So we'll give you some time to answer that, and I'll hand it over to Yitka in case there's something that Yitka might like to add.
Yeah, no, absolutely. Can I just echo what a fantastic presentation? Thank you so much. And I think there's just, as Andrea says, you know, most of our, you know, the large majority of our bariatric patients are female. And again, if we look at the demographics and the age in which, you know, bariatric surgery tends to occur, you know, this is quite a large percentage of women who are experiencing the menopause and weight loss surgery at the same time. And I just think it's so important that we raise these issues. And just here, so the key concerns for weight loss recipients pre-menopause, there's an overwhelming 86% about weight gain, bone density changes, and hot flushes. There's been nothing about breast changes, but I think, yeah, weight gain, gosh, that's just overwhelming, really, isn't it, in terms of responses?
Sure. Okay, and I think we have another question that we can pop up. So, can weight loss surgery or bariatric surgery impact menopause symptoms? So I want to select one of those. I think it probably goes without saying that we will know the answer to this from Nicole's fabulous presentation. 100%, of course, that's fantastic. Okay, so I think we have maybe another couple of poll questions. So thank you everyone for answering these. It's great to have this sort of engagement. So the next question is, which hormone do we want to support the production of during perimenopause? So we have estrogen, we have progesterone, cortisol, or all of the above. So fill in your answers so that we can have some further discussions if we need to. Okay, so we have a mixture of answers here, but the the most popular one was progesterone, and that is the answer. So we do want to support the production of progesterone during perimenopause. Nicole, would you like to comment on that at all?
Yeah, so definitely during perimenopause, we want to be supporting the production of progesterone for as long as we can. So that's through supporting ovulation and through the other tips I talked about in the presentation as well. With estrogen during perimenopause, the body tends to, especially early on in perimenopause, the body tends to be producing quite a bit of that. That overall estrogen load during perimenopause can actually be really high. For some women, higher than it has ever been. So we typically don't need to help produce estrogen. We want to be actually helping the body to clear out that estrogen after it's done its job in the body. Cortisol, it gets a bit of a bad rap, doesn't it? But it is helpful to have little amounts of cortisol. We do want to have some cortisol. It helps us to get out of bed in the morning and be motivated through the day. But we want to prevent having super high levels of cortisol. So we want to keep that one in control as well.
Great. Thanks, Nicole. I think we have another poll question before we can ask the audience for any of their questions. So the last one here is weight gain during menopause can be impacted by, so we have the answers are stress, estrogen levels, blood sugar regulation, or all of the above. So whilst you're doing this, if you've got any questions that you would like any of either Nicole, the presenter, or Kate and Yitka, the panelists, to answer, type your questions in and send them through, and we will do our best to answer them. Fabulous. All of the above. So yes, the answer to that is definitely all of the above. So weight gain during menopause definitely can be impacted by those three things. Okay, so we, if we haven't got, I think we have got one question here that that I can put to you, Nicole, and I will just see. So the question was, how do you think the menopause is affected by bariatric surgery from the patient's perspective? Any insights? So anyone can answer that. Nicole, Kate, Yitka.
Sorry, Andrea, could you repeat that question? What was it again?
Indeed. It was, how do you think the menopause is affected by bariatric surgery from the patient perspective?
Yeah, such a good question. And I think, short answer, it depends. And it depends on when they have surgery in respect to their menopause journey as well. I think overall the wraparound service that we do as well, in terms of the diet that they have post-op, the support we give with nutrition, but also psych, is incredibly valuable. And a lot of those changes that I kind of talked about integrating to support during the menopause transition is really included with that service as well. So I think a lot of them kind of happen to be very on track with a lot of that as well, which really helps.
Great.
Can
Kate?
Yeah. So I work with a lot of patients who are a lot further down the line with their weight loss surgery and are perhaps no longer connecting with their surgical team. So a lot of clients, in my experience, who have had weight loss surgery may not have a really good understanding of a lot of the nuances within their body. So it's difficult for people to understand that their weight regain may in fact be coming from a perfectly normal process that isn't related to anything that they're doing, what they're putting in their mouth. And I see it is quite distressing, and it reverts people back to previous behaviors that created further regain. So we can spiral into a place of just not knowing what's going on, and inadvertently making it worse with some of the behaviors that are their default settings. So Andrea and I last year were dealing with our own menopause issues, and it's how this sort of situation came about, because it made us realize just how the impact of normal menopause is for a normal woman. And when you've actually had weight loss surgery, it can really spiral you into a deeper, darker place than what you would expect for somebody who hasn't had weight loss surgery. So I hope that kind of answers your question.
Right. Ika, did you want to perhaps mention anything about your experiences with your patients through this phase of life?
Yeah, I would say it's a question that's getting raised more and more. I think what you have basically, I think as Nicole and Kate, you've got two fundamental life-changing events happening at the same time, and I think in terms of, you know, and I always feel there's a bit of a chicken and egg, because women sometimes don't know whether the menopause is causing some of these mindset things, or if it's the impact and the life-changing of weight loss surgery. And I think it's one of these, it's not about measuring sort of quantitatively, although there's an element to it, but I think it's understanding how we can best support women through what, you know, again, both those times, although there's issues associated with it, could potentially be quite positive times of life. And I think with many of these things is how we support that transition. And I just think here we've got two major life events, and I think we need to understand, you know, how we can provide optimal care for the physical and the psychological. So a real biopsychosocial approach to care with this. So just thank you so much for raising this, and I'm liking the nods. So.
Yeah, look, thank you, Yitka. And, you know, as Kate mentioned before, both Kate and I, for the last couple of years, have been going through the whole menopause process ourselves. Neither of us have had weight loss surgery or bariatric surgery, but I can, you know, speak from my perspective, and I'm sure from Kate's as well, that this has given us such an insight into these, you know, body changes that we weren't expecting. Like Nicole said before, like nothing, you know, I didn't change my diet, I didn't change my exercise, but I gained 8 kilos, and I gained it all around the middle. And so it's actually a silver lining for this has been that I have been able to learn a whole lot more empathy and, you know, towards my patients, and actually have a greater understanding now of when they actually say to me, I haven't done, you know, I am following the guidelines, I'm, you know, not snacking, I'm not doing this, and yet I'm gaining weight, and yet it's going around my middle. And yeah, it's you know, it's been, you know, selfishly good for me to be able to, you know, now experience that same thing and be able to support my patients more, because I actually do have an understanding of what they're going through now. So yeah, that's, you know, just from my perspective. I do have another question here for you, Nicole, and it's from Mary O'Kane, who is the chair of our international Federation for Obesity, the Ifso IH committee. She's asked, given that zinc can induce copper deficiency, could you comment on the importance of seeking advice when taking supplements?
Yeah, definitely. So I think really important with all supplements after surgery to check it through your nutritionist, your dietitian, or your GP, whoever your practitioner is, because not only can certain like zinc cause copper deficiency, can also accumulate to toxic levels in the body. So can a number of other vitamins like vitamin B6 and other minerals in the body too. So I think it always helps, definitely. It is important to have a practitioner that's monitoring that for patients, and also get those bloods checked consistently as well.
Right. Okay. Is there anything else? It doesn't appear that we have any questions. So if anyone in the audience wants to ask a question, I'm giving you the opportunity to now. But if we don't have any more questions, and there's nothing that any of the the panelists want to comment on. I think we could probably finish up this webinar. Again, I want to thank you, Nicole, for an amazing, knowledgeable presentation. It was, it highlighted a lot of the concerns that our patients, especially our female patients, experience. And thank you to Kate and Yitka for your contributions as well. And of course, we want to thank Ifso for giving us the opportunity to be able to do these webinars and, engage with our colleagues worldwide. So, yeah, really grateful to all of you guys and grateful to Ifso as well. So on that note, I'll say goodbye, but a reminder that it is available on the Ifso website for members, and if you're not a member, it is available free on the Ifso YouTube channel. So thank you guys, and we'll call it a night in New Zealand. It's 10:37 p.m. I think it's early it must be 12 hours behind for you, Yitka, so 10:37 in the morning. And I'm not sure what time it is everywhere else in the world, but yeah, we'll say good night now. So thank you everyone for being a part of this.
Excellent.
Great.